Okay, we can start.
Okay. Okay, let's start. Just give me a second. I will set the timer for you. Okay. Enter the cubicle.
Hello,
Hello.
I'm Dr. Ifrahmat. My GMC reference number is this. I'm one of the junior doctors in this clinical setup. Can you please confirm your name and age for me?
Yes, I'm Jenna, 31 years old.
How can I help you?
Doctor, I have been feeling really, really tired for the past few months.
All right. So you are feeling tired for exactly for how many months?
3 months, doctor.
Okay. Um, what about the onset? Was it sudden or gradual?
It started gradually, and I believe it's getting worse with time.
Okay. Anything that makes it better?
No, doctor.
Anything that makes it worse?
No.
Is there any other associated symptom with your tiredness?
Like what, doctor?
Like, do you feel any kind of shortness of breath?
No.
Okay. Do you feel like your heart rate?
No, doctor.
Okay. Uh, um, do you do you have any history of weight loss?
No, doctor.
Right? Do fever?
No.
Okay. Do you feel thirsty quite often?
No, doctor.
Okay. What about bowel habits?
Uh, okay. Hello, Ifra, are you there? Yes.
Uh,
Continue.
COVID when others are feeling okay?
Hello.
Do you feel are feeling okay?
No, doctor.
Hello. Okay. What about your mood?
Mm, Mood is low.
Okay. And what about your sleep? Do you
Sometimes
have
I
a
do
sound
get,
sleep?
yeah, doctor. Sometimes I do get enough sleep, but sometimes I'm not able to sleep at all.
Okay. Is anybody around you told that you snore in night?
No, doctor.
Okay. Do you have any kind of headaches?
No, doctor.
Okay. Are you suffering from any diagnosed depression?
No, doctor.
Okay. Have you ever been diagnosed with any other chronic long-term illness like diabetes or hypertension?
No, doctor.
Okay. Are you using any kind of medications?
No.
Okay. Um, is there anyone in your family suffering from any long-term chronic illness or similar sleeping problems?
No, doctor.
Okay. What do you do for living?
I work as a teacher.
Okay. And who do you live with?
I live with my partner.
Okay. Is there any kind of stress in your life?
Not really.
Okay. What about your diet?
Diet is okay.
Do you exercise?
Not much.
And do you smoke?
Yes, doctor. Yes, doctor.
Hello.
Yes, doctor. I do smoke.
How many cigarettes per day?
5 to 6.
Okay. By any chance, are you taking alcohol?
No, doctor.
Okay. Is there anything, in your opinion, which can be the cause of your symptoms?
I have no idea, doctor. I'm just tired
Are
of
you
this
concerned about
tiredness,
anything?
honestly.
All right. Are you concerned about anything?
I just want to get rid of this tiredness. I don't feel like doing anything, getting out of bed. And, it's very hard for me to go to work even.
I know it must be very distressing for you. How is it affecting your life overall?
Yeah, as I have mentioned, that it is very difficult for me to go to work.
Okay. Now I would like to examine you completely. I will check your observations, your pulse, respiratory rate, saturation of oxygen in your blood, temperature,
Okay.
and
Everything
then I
normal.
will examine. Okay, now I'll examine you completely.
Okay. Normal.
Okay. Hmm.
Yes.
Um, Now, what you have told me so far, and after examining you, I think you have chronic fatigue syndrome.
Okay. What is that, doctor?
That is a condition in which there is extreme physical and mental tiredness that doesn't go away with rest or sleep, and it
Okay.
makes it difficult to carry out everyday tasks and activities.
Okay. So, what are you going to do for me
Besides,
today?
um, sorry, give me a minute, please.
You have 30 seconds left.
Okay. It, uh, First of all, I'm not even sure about the diagnosis
Okay, we
because
will end
everything
the
is
scenario
normal.
here then. Is there anyone
Okay.
else who wants to try this tiredness scenario? Please turn on your mic if you guys are interested.
Yeah, I'll like to try.
Okay, let's start again. Guys, is my voice clear to you?
Yes, doctor, it's clear. Yeah.
Okay. So
Okay,
now we have Dr. Samina with us.
no, Asma.
Asma. Okay. So, Asma, I will set the timer again. Patient is Jenna, 31 years old, and she presented with the tiredness. Okay.
All right.
Should we start?
Uh, I'm in which setting? I don't know the setting.
You're
GP?
in the GP.
All right.
Okay. So, are you ready?
Yeah.
Okay. Enter the cubicle.
Hello, my no, name is Dr. Imtiaz. My GMC number is 1234. Hello.
Hello.
Hello, I'm Dr. Imtiaz, one of the doctors here in the GP setting. You must be Jenna.
Yes, doctor.
All right, nice to meet you, Jenna. Can you confirm your age for me as well?
Yes, I'm 31 years old.
Okay, Jenna, how can I help you today?
Doctor, I have been feeling really, really tired for the past few months.
Okay, and by few months, do you mean like how, can you tell me exactly like how
Yeah,
many
like
months?
almost 3 months.
Okay, and did anything specific happen before all of this started?
No, doctor. I don't
Okay,
know, like, I don't remember anything. It just
all
started
right.
gradually and now it is getting worse with time.
Okay, so Jenna, in the past 1 month, do you feel like you've lost interest in the things that you used to like to do?
Yes, doctor.
Okay, Jenna. And what about your mood? Have you been feeling low for the past 1 month?
Yes, doctor. I have been feeling really, really low for the past few months.
Yeah. And can you rate on a scale of, 1 to 10, 1 being the lowest you felt and 10 being the highest?
Yeah, it's around 5.
All right. Jenna, anything else with that? Like, do you feel agitated, or do you have trouble remembering things?
No, doctor.
All right. What about your appetite, Jenna?
Uh, Sometimes I don't feel like eating. Maybe it's just because
Okay.
like my mood is low, but
All right.
sometimes I eat okay.
Okay. And what about your weight? Have you measured your weight? Any weight loss?
No, doctor, not recently.
All right. And do you feel like your heart is racing, or sometimes you feel dizzy?
No, doctor.
All right. And what about your sleep, Jenna?
I'm not able to get good sleep, you can say. Like sometimes I sleep well, but most of the time my sleep is really disturbed.
Okay. Is there a particular reason why? Is there anything that is bothering you or anything that has happened?
It's just the tiredness, and maybe because of my mood, I kept on
All right.
thinking, and you know,
Okay.
yeah.
All right. So, Jenna, you're like when someone is, so low, sometimes, you have thoughts of harming yourself or anything. Is that the case with you?
No, doctor.
All right. And, it's been going on for a long time. So, how is it affecting you? Like, how is it affecting your day-to-day life?
Yeah, doctor, like it's different every day. If I'm not able to get enough sleep, next day I'm not able to focus on my work. I'm not able to take
Okay.
care of my child.
All right. I'm really
Yeah.
sorry for that. Um, you know, um, and you mentioned your child. So, anyone else? Whom do you live with? Is there anyone else?
Yeah, I live with my partner and my child.
Okay, so everything okay between you two? Everything is all right?
Yes, doctor.
Okay, and Jenna, have you tried to cope up with these feelings with alcohol or smoking, anything like that?
No, doctor.
Okay, by any chance, have you tried any recreational drugs?
No.
All right. So, Jenna, by any chance, do you have any idea what might be going on?
I have no idea, doctor.
All right. So, Jenna, with this tiredness, have you noticed any change in your bowel habits, anything like that?
No, doctor.
Okay. And what about, do you feel cold when, others feel normal in a
No.
room?
No.
Okay. So, Jenna, what are you most concerned about?
Tiredness, doctor. I'm just tired of this tiredness. I want to work. I
Mhm.
want to focus on my work. I want to take care of my child. But it's just that I feel really, really low sometimes. And I don't have the
Yeah.
energy to do anything.
Okay, I'm really sorry to hear about that. I understand. I'll try my best to help you. All right. So I'm gonna examine you, Jenna. Okay. I'm gonna check your BP, pulse, temperature, and oxygen levels in your blood. And Jenna, I'm also going to, take your BMI. All right. And I'll do just a general physical examination. Is that all right with you?
Yes, doctor.
Okay.
Everything
So
is normal.
anytime. Right. So, Jenna, after talking to you, and first of all, thank you for answering all my questions and letting me examine you. So, just after talking to you and from my assessment, it seems like you're suffering from depression.
Okay.
Have you heard of it before? Do you know anything about it?
Why is it that I'm having depression, doctor?
Jenna, you mentioned that you've been feeling low for like past 3 months, and you have lost interest in activities, and you have trouble sleeping, and it's also bothering you. It's affecting your day-to-day life. So we're suspecting that you have depression, might have depression. Depression is usually when someone feels low and they have lost interest in activities daily that they used to enjoy, and it has affecting it is affecting their day-to-day life. So Jenna, we do have I want to tell you that you're not alone. So we do have a lot of help available for that. Okay. So would you want to know what we can do for you?
Yes, definitely, doctor.
Okay, so Jenna, first of all, we do have a lot of help available. We have talking therapy for that. So you can process your emotions by talking to a specialist, all these negative emotions that you're feeling. And the second thing is, there are a few things that you need to do yourself. First of all, I would like to tell you that, you can do exercise because, it has shown to be as, effective as medication. So do you think that you can do that?
Yes, doctor.
Yeah, a bit more, you can go to your friends, go out with your friends, or try to do things that you would like to do. Okay, that will make you feel better. And all as well as we can provide you with a crisis card. So whenever you're like feeling low, or you have these thoughts, you can talk to them. It is a like 24 hours helpline, always available there for you.
Okay.
Oh,
Okay.
okay.
Okay, your time
All
is up.
right. All right.
Okay. So, yeah, you did well. Okay, but you got an idea from like the previous discussion, and you jumped directly onto like loss of interest in the activities without exploring tiredness much. Okay.
Yeah.
So you mixed up things, but you did well. Management was good. Okay. So we will start with the tiredness approach, and then I will tell you the what differentials come in it and how you can lead to depression scenario. Okay. So do the OD-para of tiredness, and then comes the flaws. Okay, fever, lumps and bumps, and any changes to your weight and appetite, and night sweating. So cancers
Okay.
can present with tiredness, TB can present with the tiredness, anything chronic. Okay. So first differential that comes to your mind is flaws, cancers. Okay. Do not skip any of them. Like Ifra asked these questions, flaws. So which was good. And then both of you have discussed the thyroid symptoms as well, which is good. Mood is also a part of hypothyroidism. So which was good. Ifra did a mistake there when I told you that my mood is low. You didn't ask that grade the mood on a scale of 0 to 10, and you just ignored this positive complaint, and you were trying to make other differentials like diabetes and chronic fatigue syndrome and obstructive sleep apnea. You were exploring those things, right? But as soon as you get the something positive, you have to stop there and you will explore that thing. Okay, Ifra? Otherwise you were doing good, you were thinking about the tiredness scenarios. So low mood depression can also come with the tiredness. um just give me a minute. Okay. Yeah. So now comes the low mood. From here, you will start your depression approach. Mood is very low, 5, 4, 3. Okay. So depression has minor symptoms and major symptoms as well. So what are the minor symptoms of depression? Like at the end, you have to make a diagnosis whether it is a mild depression, moderate depression, or severe depression. And this is what you're going to decide according to the symptoms. So I have decided, guys, if this meeting ends, I will send another link in the group. Okay. So in minor symptoms, what comes? Can anyone tell the
Yeah.
minor symptoms of depression?
Actually, I
Yes,
couldn't
doc.
remember. I think that, yeah,
Yeah, you have like tiredness and loss of appetite, weight loss, excessive guilt, and yeah,
worthless. Yes, I think.
Yes, mood. So we have discussed mood, sleep, concentration, and tiredness, changes in weight and appetite, okay, and changes in the sexual desires. So these are 5 to 6 points which you need to remember regarding minor symptoms. So you can write it down. Mood, sleep. So first question that you will explore about mood, then sleep, then concentration on day-to-day activities, and changes in weight and appetite, which you can skip here because you have already explored while asking flaws. Okay, so the questions which you have already gotten the answer, you don't have to repeat those questions, but keep in mind that you need answer to these 5 or 6 complaints. Okay, so mood, sleep, concentration, changes in weight and appetite, changes in the sexual desire, and tiredness. Okay, so like you have to see that how many symptoms are positive here. And then comes the major symptoms. You jumped directly onto the major symptoms by asking loss of interest. So first ask about worthlessness. Do you feel like that? For how you are going to ask about worthlessness? Is there anyone
Um,
who can tell?
you feel like life is not worth living? I don't know.
That is the suicidal ideation. How to ask about worthlessness? Okay, so you will ask, how do you feel about
Do
yourself?
you feel?
Yeah. How do you feel about yourself? Do you feel guilty of your circumstances? Okay. And then ask about loss of interest. Have you lost interest in the activities you once loved? If these are positive, then you will go on to the suicidal ideation. And for suicidal ideation, in most of the books they have written that, do you feel like harming yourself? Instead, the better way to ask this is, what is your perception of life? And do you feel life is worth living? I personally feel like, we are giving them an idea that, do you feel like hurting yourself sometimes? Okay. And this sounds a bit inappropriate, not inappropriate, but just like I don't want to give an idea to the patient of hurting. Okay. So, in order to rule out suicidal ideation, what I prefer is like, what is your perception of life? And do you feel like life is worth living? Okay. In response to these questions, you will get an idea whether he wants to live or not. Okay. So, you can write these questions for suicidal ideation. Okay, so for depression scenarios, step 1 is minor symptoms, step 2 is major symptoms. Okay, now we have covered this. Now you need to know the cause of depression, which both of you haven't ruled out. Okay, so you didn't know. My question was, my concern was, doctor, why I am having depression, and you didn't know. Okay, so there are 4 to 5 causes in the Plab 2 which you need to rule out. Okay, so the first question that you can ask is, by any chance, have you lost anyone recently? Okay, you asked about that relationship issue. You got an idea of, like I told you about the child. You have to ask about, like, who do you live with? I live with my partner. How is your relationship with him? That is good. Okay, perfect. Then, by any chance, Jenna, have you lost anyone recently? I might have give you something here, like I have lost my brother 4 months ago, 6 months ago. Okay, so it was mild depression due to the loss of a brother. The complete diagnosis of this scenario. Okay. So, 4 to 5 causes I was telling you that have you lost anyone recently? Relationship issues, workplace issues. Okay. So, what do you do for living? Any problem at work? Any social challenges that you might have been facing? Any harassment or something like that? Okay. And we were talking about child as well. Have you delivered the baby recently? How old is your child? Maybe it was postpartum depression. Now you're getting an idea. You just don't have to ask this, like, do you think anything has triggered it? Because she doesn't know that this thing is affecting her. She might not be thinking about the passing away of the brother. His brother was passed away like 6 months ago, 7 months ago. Okay. So they will say no to this, or they might tell you that I have been feeling this way. So it depends on the situation, like what kind of information they are giving you. But if they are not opening up, then you have to remember these 5 6 causes. So step 1 is minor symptoms, step 2 is major symptoms, and step 3 is hallmark causes of depression. And can anyone repeat the causes which I have just told you?
Lost something. One, relationship, work, child.
Yeah. Yeah, relationship, work, any problem at work, any harassment, any social challenges, any financial problems, And have you delivered the baby recently? Okay. So these are the questions that you are going to ask in the causes. Okay. Then comes the fourth step, which is the coping mechanism. Have you tried talking about this with your friends and family? Okay. Coping mechanism can be in two ways. Either it is supportive, either it is abusive mechanism. Okay, so first ask about supporting mechanism, like have you tried talking about this with your friends and family? No, doctor. What has prevented you? Reflect back. Okay, so why are you not discussing it with your friends and family, that you have been feeling this much low? And then comes the abusive mechanism, which is by any chance, have you tried to indulge yourself into something like smoking, alcohol, and recreational drugs? Okay, in order to escape all of this, you can ask this way as well. And this is also going to save your time. Okay, Jenna, so in order to escape all of this, by any chance, have you tried to indulge yourself into something like smoking, alcohol, and recreational drugs? Instead of asking like separately all these three questions. Okay. So now I will repeat again, like minor symptoms, major symptoms, hallmark, causes of depression, coping mechanism. Two things come: supportive mechanism, friends and family, and then comes the abusive mechanism, alcohol, smoking, drugs. Okay. And then the normal structure of the Plab too, like previous medical conditions, allergies, medications, and family history. Okay. And apart from this tiredness, do you have any particular concerns from today's consultation? Okay. So your last question of data gathering should be this, that what are your concerns? What are your expectations from today's consultation? Okay. So this is how you're going to do the data gathering of the depression scenarios. All right. Okay. So next, the second doctor did well regarding the examination part. You mentioned about BMI, which was really good, and all the observations as well. So, Ifra, you forgot to mention BMI. Okay, so for this, you will be like, okay, thank you so much for answering all of my questions. Now I'm going to record your observations, including your blood pressure and your heart rate, and I will be doing your general physical examination, and along with that, I will be checking your BMI as well. Okay. So next, the examiner is going to give you the readings and everything is going to be normal. Okay. Then comes the management. Summarize and explain that, you will be like, okay, so you have told me that you have been really feeling really tired, and on top of that you have low mood as well, and you have some sleeping issues as well, and it started after passing away of your brother. So I'm suspecting that you might be having some symptoms of mild depression, and that is because of the passing away of your brother. Okay, and it is totally normal to feel this way, and we are here to help you regarding this. We will arrange some couple counseling sessions, and next, the whole, you guys must know that how to do the counseling regarding depression scenarios. Okay, I will not go into the detail of that. One thing which was missing was investigative part. Okay, so while telling the diagnosis in Plab 2, we use the word of suspect, that I am suspecting that you are having mild depression. Okay, so in order to confirm the diagnosis, I would like to do some routine blood investigations, including your full blood count and your thyroid function tests.